Afternoon guys, Dr. Dan from Valley Rising Chiropractic. Today we're going to talk about the number one reason why your shoulder pain might not be going away. First thing to consider is how important the spine is to movement. Anytime you experience any sort of trauma, even anytime you perform any sort of movement, the forces are anchored back through the spine. If you fall out onto an outstretched hand, even though it may appear that the wrist and the hand has experienced all that force gets transmitted back to the spine, normally the cervical thoracic junction. When we see a ton of people that come in with recurrent shoulder injuries, they may have already been advised to get a shoulder reconstructive surgery. Inevitably, they go through stages of had an initial injury, it got better, then it came back, and now the instances of shoulder pain are either getting shorter or it's constant, and it doesn't seem to be resolving. In chiropractic, we go back to the idea that just because the shoulder is the part that hurts does not mean that that is where the primary dysfunction or primary side of dysfunction is occurring. If you step on a dog's tail, he barks out of his mouth. You don't sticky tape up the dog's mouth to fix the problem. You take the foot off the tail. What we see in chiropractic offices, especially with people with experience, say, recurrent rotator cuff tears, bursitis, sometimes people come in and they've been diagnosed with like a frozen shoulder. They can't lift the shoulders past, say, 30 degrees anymore, is that the spine is quite dysfunctional as well. Especially if you've got bilateral shoulder symptoms. If you've got bilateral shoulder symptoms, the first thing to remember is you don't use both shoulders evenly. You're gonna have a handedness to either the right or the left. You weren't born with two shoulders that just wore out in your mid-30s. That doesn't happen. If you've got bilateral symptoms, that goes for the legs, knees, ankles, hips and feet as well. If you've got bilateral symptoms, it is more likely that it's coming from a central cause of dysfunction and it's wearing out the guys on the periphery rather than you had a genetic predisposition to wearing out shoulder, hip joints, knee joints, that sort of stuff. So how does the spine affect or contribute to chronic shoulder dysfunction? If we go from the side here, this is going to be difficult because I've got to keep looking at the camera, but you look from me from the side, we see the thoracic curve. Okay? They call that thoracic kyphosis because of the way it curves over. The scapulas sit on the thoracic cage. Okay? At the end of the scapula, we have a cup, which makes up one part of the shoulder joint. You've got the humerus bone in the arm, has a ball on the end of it, that makes up the other part of the shoulder joint. Shoulder joint is a ball and socket joint. Around that are the rotator cuff muscles. On the a number of surfaces are the bursa. The bursa are fluid-filled sacs that allow things to slide over them smoothly without causing injury. And tons of people these days have office jobs, or they sit, they drive heavy vehicle, they work in the mines and drive dump trucks, excavators, stuff like that. People that have to sit for long, extended periods of time inevitably start to roll over in the thoracic spine more, and they become quite rigid in the thoracic spine. They have a more pronounced thoracic kyphosis. What that's going to do to the scapula that sit on the thoracic cage is push them back away from the humerus. So we've got humerus here, scapula's right here. If I go like that, the distance between the scapula and the head of the humerus increases. But what has to happen then? This rotator cuff muscles, their job is to produce stability in the shoulder during movement. The combined pull of the rotator cuff muscle sucks the humerus into the cup of the scapula. If the distance increases, those rotator cuff muscles have to work harder to try and pull the heads of the humerus back into the scapula. What is that going to do? It's going to produce too much exertion, too much force, too much constant force on those muscles. They're going to start to burn out. They can get trigger points in them. They can start to develop micro tears over periods of time. And that may be one reason why recurrent rotator cuff tears aren't healing up. It's because your body is constantly producing more of them just to keep the shoulders functional. So what do we do as chiropractors? We analyse the spine. We find restrictions or subluxations. That's the only stuff that we diagnose and treat with the adjustment is a subluxation. If we find one of those in the thoracic spine, we adjust it to restore the normal movement. Most people are losing their extension through the thoracic spine. They're chronically stuck in this position. If you can produce some more extension in the thoracic spine, what happens naturally is the scapula is going to come closer to the heads of the humerus, relieve tension on the rotator cuff muscles. The bursa, same thing. If there's too much tension to one side of the shoulder joint than the other, it's going to produce more wear and tear on one part of the bursa than another, and then you can get bursitis, which itis just means inflammation. You're going to get inflammation of the bursa. Until this is corrected, that structure, that complex that is asymmetrically loaded or loaded in a way that's not natural for that joint is going to continue to re-injure and re-inflame. The body's only tool to fix anything is inflammation. Okay, so any injury is going to cause some sort of inflammation. If it keeps occurring, you get chronic inflammation. Another important area to look at for particularly recurrent shoulder injuries and chronic shoulder pain, and especially frozen shoulder, is the base of the neck. The neurology that comes out of the base of the neck drives the arms and the shoulders. If the connection between the brain and the shoulders doesn't work well, the information from the shoulders about damage that is occurring back up into the brain isn't as good. The information from the brain back into the shoulders about how to fix it isn't as good. Okay, if you've got a telephone line and you cut halfway through the cable, the message on the other end isn't as clear. Vice versa, the message back isn't as clear. So we've had great success in the office with people that have limited shoulder range of motion by adjusting the base of the cervical spine and often the thoracic spine as well, because if you roll over too much in the thoracic spine, what else does that do? It pushes your head out in front. Trapezius muscles are going to switch on to try and brace the base of the neck. They're going to stay that way until that pressure is relieved or until the head can come back. That's going to produce more inflammation. Often if we have justification to x-ray, there's going to be lots of degenerative changes, particularly from C5, C6 and C7, which make up the brachial plexus, which drives the arms and the shoulders, and you are set up for a lot of shoulder dysfunction should you not correct that issue. How do you know if you've got these sorts of problems? Basically, if you spend long hours at a desk, you should probably get checked by a chiropractor. Human beings, I've said this before, but human beings were not meant to sit, let alone sit at desks and computers stressed to the eyeballs for 8, 10, 12 hours a day, and then go home and work on computers and look at iPhones again. Just doesn't make any sense for what is essentially a really intelligent chimpanzee to be spending that amount of time in a fixed posture, stressed with no physical release. People that are getting headaches and have shoulder dysfunction, upper thoracic spine and base of the neck, I would wager is dysfunctional every single day of the week. Also, if you're getting stuff like sciatica or just low back pain or a thoracolumbar type of pain, any sort of spinal pain or pain that could be produced from the spine but is referring through the limb and shoulder stuff, you've you've likely got spinal dysfunction that is contributing to, it may not be the primary cause, but it will be at least contributing to a lack or delay in healing of those symptoms. Obviously, sometimes the shoulder is so destroyed that a shoulder reconstruction may be warranted. But again, like anything, shoulder reconstructions are not a one hit and quit deal. There are many people that have to go in for 2-3 shoulder recos and it still doesn't work. So my philosophy is always to err on the side of the least invasive treatment modalities first. Then, if at the very last resort, go under the knife, because there's risks with everything, you know. Cool. Do I have anything else to say about shoulders? That's probably enough. Again, so even we've talked about shoulders, but carpal tunnel and wrists are the same neurology, same kinetic chain. One part doesn't work, it's like a chain, it's like a team of people at work. If one guy's not doing his job, everyone else has to pick up the slack. The one that's slacking off isn't the one that burns out, it's everyone else that has to make up the extra effort. Hey, Jonathan Perry from uni, how you going? Excellent. Hope you enjoyed that video, guys. If there's anyone that we can help out for you, we're in the East Maitland area, Valley Rising Chiropractic. You can check us out at valleyrisingchiropractic.com or on Facebook under VRC. If there's anyone we could possibly help out for you and maybe improve their life at all so they can get back to doing the things that they love, please contact us, and we'd be more than happy to try and help them. We all only get one life, and it's not worth spending that, a significant portion of that life in pain or not being able to do the things that you love doing. Excellent. Like and share the videos. Please comment below if you have any questions, or if there's any DCs out there, chiropractors, that have any tips or anything for people. Comment those as well. And I hope you have a great weekend, guys. Thanks so much.